Hi, my name's Amber. I am one of the day shift house supervisors. I work on the hospital side. I've been at Astera for just under 5 years. I have 16 years of nursing experience, and so when I was asked to come talk, I thought that was kind of an honor to come visit with you guys.
Hi, I'm Charlotte. I am working in a new position. Actually, I am in clinic social services. I started in November and I'm absolutely loving my position. And so I've been here, but I come with quite a bit of a different experience and look forward to continuing on.
I'm Peyton. I'm the Director of Clinic Operations here at Astera, and I've been here for about 2.5 years.
I'm Kelsey, and I am the ER and Ready Care Nurse Manager. I've been at Astera for the past 7 years and in the ER for the past 6.
I'm Paige Selvey. I'm one of the family physicians here. I started back in August, took a little break for a baby, and then just got back at it in December. And excited that you're all here. We want to make this really optimal for what you guys want to get out of it. And so we thought we'd start by taking any questions if there's anybody that had thought about questions on how to speak to their physician or anything in the medical field. So does anyone have anything right away? Louder. Am I talking loud enough now? Do I need to repeat that at all? Any open questions or things that you've had concerned about when you're anywhere in the clinic, the hospital, the emergency department? No? All right, we'll just get started then. So part of this presentation is we put together normal questions that we hear when we're seeing patients, and some of those solutions behind that. But if there's anything that comes up while we're talking about these, please feel free to interrupt us or raise your hand, okay? So some of the common concerns we have, and we kind of split these up so some of us might talk for each of these, but one of the biggest things I hear particularly is my provider seems so busy. I don't feel like I can get enough answered, or I don't get all my questions answered, or I feel like I can't ask what I want to ask. Does anyone in here ever feel that way or experienced that? Yeah? Okay. And I think this is one of the hardest ones to answer because there's a lot of stuff going on in the background, but one way to try and help with this is when you come in having a priority of what you want to get done today. So if you want one specific thing answered, make sure that's the first thing that you talk about in that visit. Coming in with a list is really helpful too, because then the provider can look at it and say, what can I cover today? What seems reasonable to be covered today? So those are some easy things that you can do to try and help with your visit. Some of the things that we'll talk about later on too is bringing a family member can be helpful to make sure that you're not forgetting things or you're remembering to ask those things that you've been talking about with your family. Anyone have anything else to add to that? The next one is I don't think my provider listens to me. I'm sure we have all been there too. Some things that normally providers do is we start talking really fast. I'm probably talking really fast right now anyways. The other thing is we've spent a lot of education learning these big words and these big terms for things, and sometimes we forget to slow down and talk in English. So if you are ever in a visit where you're like, I don't understand what you're saying, it's okay to ask and say, what do you mean by that? Sometimes that just reminds us to say, hey, we have to slow down. We have to actually address this in human terms because that can be hard too. I think it's absolutely okay to tell your doctor that, hey, I'm not understanding what you're saying, or I'm concerned you're not listening to me. Using those C words can be really helpful to make the provider say, oh, they didn't understand anything I said in the last few minutes. So, anyone else have anything to add? I must be covering these really well. Any questions or concerns about anything that we've talked about? Yeah.
Do you guys care if you get recorded? Sometimes I've asked if the person cares if I record what they say, just so I can have it to listen to later, because I tend to forget things and then I can Google words that I might not have understood.
I would say that's very individual based on whether or not someone would want to be recorded. I will say we don't allow recordings for like procedures just because it's a policy here, but it would be something worthwhile to ask your provider.
As long as you receive their consent and they say, yes, you can record me, then absolutely. If you do it kind of secretively, then that's where it gets a little messy. So as long as you ask and they say it's okay, that's usually fine.
Thank you. Yeah, that's a good point. Other questions about that at all? Okay. This next one, I think a lot of us maybe think about in the back of our head, but I don't have the training, and so I guess I shouldn't question what they're saying. And, you know, there's so much value that you bring to your visit because we don't know what you're feeling. We don't know how you're feeling. We don't know your history as well as you do. And so it's always important to bring forth, like, I don't think you're hearing me, doc. I think I'm experiencing this, this, and this. That kind of goes with the Google searches, you know. If you've been the one living with your symptoms and dealing with your symptoms all the time, it's much easier for you to look up something that might be reasonable for what you've been feeling. And so I think those things are helpful in a visit, okay? Just because you have that history and that perspective. Does that make sense? Yes. Okay. So I'm all for it if you want to Google and come to the visit and ask questions. And sometimes it's really helpful because you've kind of ruled out those things. You know, a lot of what we're doing in our head is saying, could it be this? Nope. Could it be this? Nope. And if you've already done a lot of that work ahead of time, that can be really helpful. And I think we talked about this next one quite a bit, but if there's terms or things that you're not understanding by the way we're presenting them to you, very important to ask, what does that mean? Because it's hard for you to be a good advocate for yourself if you don't know what we're talking about. Okay. I feel like I've been talking a lot, but.
The last one here is, who do I go to if I have a problem with a staff member or provider to resolve my issues? One thing you can always do if you're in a clinic visit, you can always ask to talk to the clinic manager, the clinic supervisor, and they'd be willing to come chat with you right there in your visit. As a hospital stay or ED visit, you could always ask for the supervisor on staff as well.
Sure. Thank you.
These are some of the questions that actually have brought me to the clinic as a in social services, and then hopefully some of these will be helpful to you. What do I do if my medications are too expensive? And I think this is one that we are really seeing more and more of. And I'm sure there are lots of people here who struggle with the cost of prescriptions. And there are different programs out there that we are working with. You know, there's pharmacies that have discount programs. There are things on the internet where the pharmaceutical companies will help you cover the cost of those insurances. And we have some wonderful patient financial advocates that are here in the hospital that will help you. And we'll talk about that in a little bit here as well. Any questions? Okay. How can I afford to come to the doctor? There again, our patient financial advocates here within Astera Health are phenomenal. And just being able to refer them and they walk through with you and know that there are different things that they can help you with. If not, social services, we've got wonderful social services here in the clinic and in the hospital who can connect you with, there's the Mentor Navigator, we've got, you know, different programs within the county, and we really try to do what we can to make sure that you know the different programs that are out there and assist you to get those applications where you need to have them. Is my ER visit or hospital stay going to be covered? What if I don't have insurance? And those are very real questions, and we find people maybe not coming in as soon as they should because they're afraid that they won't be covered, or they, you know, stay home longer and then they end up not being seen and things get worse. And so, you know, one of the things to do is really talk to your concerns and say, I need to speak with somebody in social services. What we want is you to come in, you know, make sure that you're being taken care of. We have wonderful, like I said, programs that will help. The best thing we can do is make sure that you are taken care of. That's going to be the priority. Any questions so far? And another thing that is very dear and near to my heart is how do I fill out a healthcare directive and what is a healthcare directive? How many of you have heard of a healthcare directive? Oh, wonderful. That's terrific. If you have not, I personally am here to help you fill one out. A healthcare directive is a paper form. It gives you the opportunity to have a voice if you are ill or you are unable to, and you choose people who you know that you love and you can trust. You have your voice in those documents, and we can notarize right here. We have some wonderful notaries here, and make sure that this is a living document, so make sure that you're updating your document. If you haven't done your healthcare directive for a while and you're like, oh, it's been several years since I've looked at this, pull it back out. Make sure that it's updated. Make sure your wishes are still in line with what you want. It's really important. If you're not sure, if you're like, this is something that's really kind of scary, a lot of people don't look at it and they're like, this is too long, I don't know what to do with it. Give us a call, we can make an appointment, and we can walk through it together and fill it out, and we can get it notarized and copied and sent home with you and get it scanned into the system right away. And so you have it there for you. So just some things to think about. Yes?
Do you have one that a person could take home today?
You know what, I can get you one. You talk to me, I'll be happy to get you one. Okay? Anybody else any questions? Okay. What resources are available in the community help? We have wonderful resources both in the hospital side and the clinic side. Often, sometimes a doctor will pull me in because there's somebody that needs housing help, or they need help with addiction, and they need to know where the treatment centers are, or they just need help with food, and we can connect them with, St. Anne's has a wonderful program. So there's lots of different resources, and we have that availability for you. And so it's just a matter of, again, have a voice, speak up. Astera Health has done a wonderful job of putting those things out there so we can connect you. We're here to help you, and that's what I want to do for you.
Can you talk about community paramedics?
Yes, we also have a wonderful community paramedic, and the answer is always yes, for the most part. He does a wonderful job. He's been out. He does checks INR. If we need to do a wellness assessment, he will go into the home, and he has a list of questions that he will go through. We want to make sure people are safe in their home, and sometimes it's not the case, and we need to make sure that we care enough about our community members. If they're not safe, what are we doing to take care of them? And if we need to make a vulnerable adult report, that's what we're here for, because we want to make sure our individuals are taken care of. So he goes out and he has done numerous things. We've all called on him several times, and I can't say enough, because we're very lucky to have him within our community. And so just one more thing that Astera Health has done for us. Anything else?
I don't think so.
I'll let you.
Talk to if you want to have a community paramedic.
You can really talk to anyone at the hospital or clinic. What we do on the provider side of things is we put in a referral for him, and we kind of say, what is he going out there to do? Is it lab work? Is it blood pressure checks? And then he'll call you and make an appointment to come on out there. Okay. So really, you could ask your nurse, you could ask your provider, anybody in the clinic. Good question. Thank you. Other questions right now?
What's the best way to address, like, say if you have a fairly minor issue, but it's been bothering you for a while, and you're thinking, well, I'm not sure if that's worthy of an office visit. Is it the best way to, like, message your physician and say, is this something I should look into? Or?
You can absolutely use my chart. That's a great way to get a hold of your physician or the physician's team. You can always call. Okay, if you feel like I don't know how to do that tech savvy wise on the My Chart, you can always call. We have nurses that answer those lines and kind of give recommendations on whether or not you should come in. Sorry. And they'll give you some good advice on whether or not they think you should come in for a visit. Okay.
Can you repeat the question so we know what you're answering?
Yeah, absolutely. So she was saying, how do I know I should come in? If I have a question or a concern, how do I know it's worth an office visit? Okay.
If you're concerned about cost, can you call beforehand and get a quote on what that procedure or something may be?
Yep, and this is where those patient financial advocates really come in key, because we don't want you to be all of a sudden hit with a big bill that you weren't prepared for. The other great tool that you can use is call your insurance. Your insurance is going to be the number one person that will tell you, is that test covered, is it not, or what would I expect to be paid? Okay, because a lot of times we can do things on the background and say it should be covered, but your insurance is going to be the big one that's going to say, yes, it is covered. Other questions? Oh, and what do the community paramedics do? And really, they are great. I mean, they are really yes people. And so especially if you're having difficulties even getting a loved one to come in for an IR check or something, they can be really helpful in between visits to try and help with that care. Anyone else on community paramedics at all? And then this next one, how do I know I won't have any side effects to medication? This is a hard question. Anytime you get a medication, a treatment, there's always the potential for side effects. We can't guarantee that we'll never give you a medication and no side effects will happen. It's our job to educate you on those side effects, but also to empower you to bring forth your concerns if you start a medication and you're feeling off since you started that medication. So I always tell my patients, if in the, anytime they start a new medication and they're having new side effects or new things are coming up or they have new concerns, bring them up to me. Because just because they're not classic side effects doesn't mean it's not the medication that's causing it. The other great resource for this is your pharmacy. The pharmacists know so much about these medications and they can really hone in on whether or not they think a medication could be causing a side effect.
Just another thing real quick with that as well is just make sure that you're also letting your provider know what other medications you're taking, even if it's like herbal supplements and things like that, because sometimes it's the interaction that can be causing those side effects. So just something that I've learned, it's something that's really important to think about when you come in.
That's a really good point too. And then always, anytime that a new medication is being started, you should absolutely ask, are there any common side effects? What should I expect when starting this medication? Is there anything I should watch out for? Do you want to speak about mental health resources?
Oh, sure. What are some of the mental health resources in the community and how do I access these? That's a really good question. And as we know, mental health resources are so limited sometimes because of the need. And so we are really fortunate. We have some wonderful therapists here within Astera Health. We can make those recommendations for you. We have different support groups that with the home health groups that we work with that support grief support. We also work with different agencies and have those resources outer lining where we have a list of different mental health agencies that we work with. So if you're feeling that you have a need, please come see us. We can try to connect you as quickly as possible. There's always the crisis line, we have suicide line, we have lots of different places that we can make sure that you get those help as soon as possible. We have wonderful people, nurses, who absolutely know where to go and when to go, and we've been very fortunate with that. There's more and more places that we can connect you with, but it's not something to mess around with. Make sure that you get the help that you need. Tell your doctor if you're feeling the need to connect. I'll let you go with the next one.
This next one is kind of, we talked about a little bit earlier, but why am I limited on what I can ask during a visit? And I think that really comes down to time, and it's very provider independent. So it really depends on how much time that provider has or is allotted to spend with you. And, some providers are a little bit better on staying on task or, falling a little bit behind, but it's really provider dependent. And I think some ways to try and help with that is know what you want to ask during your visit, again, that list, and what's a priority to answer today. The other thing you can always do is ask for a longer visit, okay? You can always ask, say, I feel like I'm not getting my questions answered. Is it possible to get a longer visit time? Some providers will do that too, okay? The other thing is certain medical visits, such as the initial Medicare wellness examination, the hands-off visit, is something new if you haven't experienced it before. There's no physical exam, and it's a very specific questions only. So that is one of those types of exams that is a little bit more hard to understand, that you can't ask and answer questions during those exams that are like a normal visit. So there, like, no physical exam can be done, and so those special exams are a little bit different, if that makes sense. Yeah.
How much time is allotted to one of those wellness visits?
For the hands-off, it's 20 minutes,
20 minutes?
right?
Okay.
Yeah. So,
Are they gonna tweak so you do a blood test? Are they gonna add more things in there like PSA? I mean, that's, I think is
yeah, so that's a good question, and I don't know the exact answer to that, because we're kind of always reviewing. Sorry, are they gonna add any additional lab tests or evaluations for those exams? And we're always kind of reevaluating what to be done, and Medicare kind of gives us guidance on that, so I can't give you a clear answer on whether or not they'll do that. Okay. Other question? Do you want to talk about hospital follow-up?
Sure.
So how do I make my hospital follow-up appointment? Usually when you're discharged, we'll go through a packet of information. There will be all kinds of different things on there. We'll talk about your medications, we will talk about new medication education, and then further down it'll say the recommendation. You should be seen within 2 to 3 days or 3 to 4 days. Traditionally, we will schedule that appointment for you. Occasionally, if you were to be discharged later in the evening, during the night, we will start that process and then complete it the next day, where someone will call you and follow up regarding what works best for you. We like to try to have follow-up visits in place before you leave, but in the event that those don't work for you, or you know you have multiple dates coming up, you can always let us know that and we can work through that, or you can reschedule them. Otherwise, you can always call the registration desk and just let them know I was in the hospital. It was recommended that I see my provider in 3 to 4 days. How can you help me? And they will look at who's available. It might not be your provider, but maybe somebody who works very closely with them who can also follow up with your visit here. A couple of things also, tips for good communication. So when you are in the hospital, we see this regularly, there is so much information. You're getting a new diagnosis, you're getting a new diet, you're getting new medications, you're maybe dealing with some news that you never thought you would have to deal with. So one of the things that you can do is get a notebook, take a piece of paper, write down all the questions you have, whether it be about a medication, or what does this word mean, or how do we eliminate fiber from our diet, how do we add potassium to our diet, no matter what it is. Because one of the things we often hear at the hospital, people will talk to the doctor and then an hour later, oh, I forgot to ask that, or oh, I meant to ask that. And so it's really important to just write down everything you're thinking. And maybe put a prioritization next to that. You know, which ones are my most important questions? Because it never fails. We all do it, whether it's at the hospital or the grocery store. You get to your car and you forgot that one thing you knew you needed. And so that, yeah, it happens all the time. And if you're sitting in the hospital and you have a lot going on, you're not going to remember everything. So it's really important to write it down and try to just keep a list. If you don't ask questions, if you don't understand what the doctor is saying, stop them and ask. I've been a nurse for many years, and there's still things they say that I don't understand. So I'll say, could you please explain to me what that means? Research studies are constantly coming out. Treatments are changing. Things that we used to do, we don't do anymore. Things that we were told not to do, now we do again. So things are changing, and it's okay to just stop and say, hold on, I have a question. Why would we do this? Why would we give this medication? Why would we take 3 pills for this? You know, it's okay to ask those questions. One of the other things that would help with communication is bringing another ear to listen. as a hospital supervisor, I know sometimes, especially in this area, we have some very large families. We have families with several kids. One of the things that can be challenging is getting all of that information out the same to everybody. So something we like to do at the hospital is appoint a spokesperson. Let's say Dr. Selvey is the provider. If she were to speak to each of the 9 kids individually, it is very possible that the information may not be the exact same. That can cause some miscommunication. That can cause maybe some feelings. We have times where maybe things are a little bit more complicated. And so appointing that person, maybe the one with the notebook who can be the central communicator, is always good to think about too, so that everybody is getting the same information at the same time. Phrases that you can use. Are you hearing me? Would you explain that more? What does that mean? Any one of those, that they're not offensive, they're not going to cause any feelings. It's just letting us know that what we're saying is not registering the way you want it to. And so it's okay to stop us and say, hey, I don't understand what you're saying. Does anybody have any questions about any of the communication aspects? No? Okay, I already talked about this, appointing a central spokesperson. So again, it's hard to touch on all those points. It's hard to, as a supervisor, I oftentimes get a lot of phone calls from the same family members wanting the information. It's not intentional, but there are times where maybe I leave part of it out and I didn't tell this family member, and now they're communicating. And so it's hard to spread all of the information accurately 100% of the time, numerous times. So if you have that person, whether it be a power of attorney, a trusted friend, maybe one of the children, anybody who can be that contact person, if they want to be here when the doctor rounds, if they are staying with the family, whatever your situation may be, it's just a good way to have somebody kind of at the forefront of collecting, gathering, sharing information. Keeping a notebook to refer back to your prior questions. I know that we have little notepads, even like you have on your table there, are wonderful. A lot of family members will sit there and write down everything that they're thinking, and we address those one at a time. And maybe it's a nutrition-based question, so we bring the nutritionist in, or pharmacy. No question is too silly, especially if it's a concern to you. We can certainly address those. Any other questions? Okay, I'm going to hand over.
Just have a couple things.
Okay.
A couple other things in the hospital specifically is each of the rooms has a dry erase board, so you can always write questions there. In which it is a great place for the team to see your questions, especially about your hospital care or your family or loved ones' hospital care, especially if you don't have a notebook. That can be a great place to kind of put concerns and stuff. The other thing that we've been doing in the hospital to try and help with communication is our daily rounds. This happens Monday through Friday, and it's with our team. So usually it's one of the physicians, the pharmacy, our nurse managers, social work, as well as dietitian. And so that can be a really helpful time for family members to be there, because you can get a little point of view from each person in the team, and ask questions to specific team members, or just get a whole good view of what's been going on with your loved one's care. Those usually occur around 10:30 to 11:30, depending on what's going on in the hospital. But we try to keep those at the same time so that family members can try and plan to be there. So that's always a great time too. Any questions about any of that? Okay. Oh, this is kind of hard to see, but this talks a little bit about our patient financial advocates and kind of what they do. Shar, do you want to talk about this a little bit more? Or?
I can. I will credit to the patient financial advocates for their knowledge on this, because this is really their expertise, and so they are phenomenal at doing this, and so my knowledge is not as great as theirs by any means. However, this is really some of the different things that they're able to do, and they do it well. First, you have the hospital, the HPE. hospital, you'll have to forgive me. I don't have my glasses, so my reading and it's small. So go for it. Yeah.
Yeah.
Thank you. 'Cause
Claire, do you want to come up and speak about it? No?
no. Where is our patient financial advocate? Yeah. Yeah.
Good. Oh, yeah. Do you want to say that?
The patient financial advocates will be doing a bite-sized conversation later in the future, so that one will be helpful.
You know what? I will be attending that myself. No. Honestly, the MNsure application, we also have the financial assistant application. If you're struggling, they will actually talk to you about all three of the different programs. We also do, like I said, mentioned the MNsure Navigator. And the MNsure Navigator is something that we send out a letter. It goes to your county. And what happens there is that they will talk to you about the different programs within the county that can help. The patient financial advocates work with the programs that are here within Astera Health, and they're very good and very knowledgeable. I have to be honest, anytime I've had a question, it has been boom. They've been able to answer it for me. They walk through it. They tell me what it is, and so it's been very beneficial for the patients that I've worked with. And so this truly is their expertise, and I would strongly, strongly encourage you to attend that bite-sized conversation because it will be a good one. They're very knowledgeable.
I think, again, the other thing, medication costs often come up as a burden to care. And just know that there are lots of resources, even here in the hospital or through voucher programs, that we can work with you to try and get those cheaper. So if you ever go to the pharmacy and it's $600 for a prescription, don't pick up that prescription. Call your provider and ask, is there an alternative? Is there a coupon for this? Is there options to decrease this cost? Because that's oftentimes something I hear from my patients. And sometimes, unfortunately, they come to their next appointment and they haven't been getting treated because they couldn't afford it and they didn't know that was an option. And so that's always something that's really important. You want to talk about it?
Sure. Is there anything more? I think you talked. Perfect, yeah. So we talked a little bit earlier, if you are at an appointment at the clinic or the hospital and you have a concern about a staff member or provider, you could always ask for a on-staff supervisor or manager, and they'd be willing to come talk to you in that moment or within a couple of hours of that moment to kind of review what's going on, what concerns do you have, and take it from there. And then after your visit, if you have a question or you forgot or you weren't able to talk to a supervisor on staff, you can contact this quality of care line. Also, if you have concerns about your healthcare quality or any concerns from your visit, this number is available and you'll be able to speak to one of our quality reporting and patient experience specialists. They gather all the information and then they reach out to one of us depending on which area it happened in. And then they go from there on an investigation or whatever you want to call it. But any questions?